Today, we are going to look at a BodyViz brain builder about the stomach and stomach ulcers. The stomach serves three functions, which are the storage of food, mixing food and gastric secretions in order to form a semi-liquid substance termed chyme, and the regulation of the passage of chyme into the duodenum of the small intestine. The stomach, which is J-shaped, has two openings, which are the cardiac orifice, which is continuous with the esophagus, and the pyloric orifice, which is continuous with the duodenum of the small intestine. The stomach also possesses two curvatures, known as the greater and lesser curvatures, as well as it is subdivided into four regions: the fundus, body, antrum, and pylorus. The fundus extends superior to the cardiac orifice on its left side. The body composes the majority of the stomach. The antrum extends from the body of the stomach to the pylorus, which is the tubular portion of the stomach. The pylorus possesses the pyloric sphincter, which is a circular band of smooth muscle that regulates the passage of chyme into the duodenum of the small intestine, as well as preventing the regurgitation of intestinal contents back into the stomach. The stomach is arranged into four histological layers. These layers, from superficial to deep, are the mucosa, submucosa, muscularis externa, and serosa. A stomach ulcer is the result of gastric or stomach acid damaging the mucosal lining of the stomach, producing open sores that often bleed and cause stomach pain. Between 6 and 10% of the U.S. adult population is diagnosed with some form of ulcer each year. Next, we will look at the symptoms, causes, and treatments for stomach ulcers, and finally give a patient example. Typically, individuals with a stomach ulcer do not exhibit any specific symptoms. However, the frequent sensation of a burning abdominal pain may be an indication of a stomach ulcer, especially if the following are present: nausea, vomiting, heartburn, pain that typically occurs at night or after eating that persists from minutes to hours and reoccurs for several weeks at a time, and lastly, bloody or dark stools. The three most common causes of stomach ulcers are excessive secretion of gastric acid. This damages the mucosa of the stomach, causing pain and irritation. If the damage extends into the submucosa, bleeding into the stomach lumen occurs, and the pain is significantly more intense. Overusage of NSAID painkillers. NSAIDs are non-steroidal anti-inflammatory drugs, such as aspirin, ibuprofen, or naproxen. These drugs contribute to the formation of ulcers by reducing the effectiveness of the protective characteristics of the mucus produced by the mucous neck cells. As a result, gastric acid damages the stomach's mucosa, causing pain and irritation. H. pylori bacteria. This bacteria is typically found within the stomach of up to 50% of people worldwide, and in most individuals is harmless. However, in some people, H. pylori reduces the protective nature of the stomach's mucus, and thereby contributes to the formation of a gastric ulcer. Treatment of stomach ulcers is aimed at reducing the production of stomach acid and the elimination of a bacterial infection caused by H. pylori. Medication to reduce the production of stomach acid can be used. Medication to coat and protect the stomach's lining against the effects of stomach acid, like Pepto-Bismol. And lastly, antibiotics to eliminate an H. pylori infection within the stomach. Stomach ulcers can and will heal themselves if the causative factors are eliminated. Then, with an alteration in lifestyle factors that irritate the stomach, such as reduced smoking, alcohol, and NSAID usage, with an increased consciousness of one's diet, the reoccurrence of stomach ulcers can be either reduced or eliminated. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 26. Sex, female. Chief complaints, severe stomach pain, nausea and vomiting, dark and bloody stools. You invite the patient into your office for an examination. Your patient explains how they first felt the pain a few weeks ago and has gradually worsened. At first, she felt the pain and thought it was associated with her menstrual cycle. But as it progressively worsened to involve nausea and vomiting and lasted for numerous weeks, she became concerned. When she started having dark stools with blood in them, she knew it was time to schedule an appointment and visit her provider. You ask your patient about any medication she takes. Your patient explains how she is not on any prescription medication, but she has been taking ibuprofen every day for the past 2 months, that she originally started taking for a sprained ankle, but then never stopped once her stomach pain started, hoping that the ibuprofen would help. You diagnose your patient with stomach ulcers and explain to them that you believe the cause was prolonged use of ibuprofen. You talk to your patient about stopping the ibuprofen and taking Pepto-Bismol to protect the stomach lining. This is a classic example of stomach ulcers. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel. Or, if you are new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.